Introduction to Cardiology, Blood Transfusions. To avoid transfusion reactions, it is best to transfuse only matching blood types. That is, a type B positive recipient should ideally receive blood only from a type B positive donor, and so on. That said, in emergency situations, when acute hemorrhage threatens a patient's life, there may not be time for cross-matching to identify blood type. In these cases, blood from a universal donor may be transfused. Common diseases and disorders of blood vessels and/or blood arteriosclerosis. Arteriosclerosis is normally defined as the more generalized loss of compliance or hardening of the arteries, whereas atherosclerosis is a more specific term for the buildup of plaque in the walls of the vessel and is a specific type of arteriosclerosis. When arteriosclerosis causes vessel compliance to be reduced, pressure and resistance within the vessels increase. This is a leading cause of hypertension and coronary heart disease, as it causes the heart to work harder to overcome this resistance. Any artery in the blood can be affected by these pathological conditions, and individuals who have pathologies like coronary artery disease may also be at risk for other vascular injuries, like strokes or peripheral arterial disease. Atherosclerosis is a type of arteriosclerosis in which plaques form when circulating triglycerides, cholesterol, and other substances seep between the damaged endothelial lining cells and become trapped within the artery wall, resulting in narrowed arteries and impaired blood flow. Sometimes a plaque can rupture, causing microscopic tears in the artery wall that allow blood to leak into the tissue on the other side. When this happens, platelets rush to the site to clot the blood. This clot can further obstruct the artery and, if it occurs in a coronary or cerebral artery, cause a sudden heart attack or stroke. Alternatively, plaque can break off and travel through the bloodstream as an embolus until it blocks a more distant, smaller artery. Peripheral Arteryterial disease, or PAD, also called peripheral vascular disease, or PVD, occurs when atherosclerosis affects arteries in the legs. A major risk factor for both arteriosclerosis and atherosclerosis is advanced age, as the conditions tend to progress over time. There is also a distinct genetic component, and pre-existing hypertension and/or diabetes also greatly increase the risk. However, obesity, poor nutrition, lack of physical activity, and tobacco use are all major risk factors. Treatment of atherosclerosis includes lifestyle changes such as weight loss, smoking cessation, regular exercise, and adoption of a diet low in sodium and saturated fats. Medications to reduce cholesterol and blood pressure may be prescribed. For blocked coronary arteries, angioplasty or coronary artery bypass graft, or CABG, CABG surgery, may be warranted. In a carotid endarterectomy, plaque is surgically removed from the walls of a carotid artery, which is the main source of oxygenated blood for the brain. Edema and varicose veins. Despite the presence of valves and the contributions of other anatomical and physiological adaptations that assist in moving blood through veins over the course of a day, some blood will inevitably pool, especially in the lower limbs, due to the pull of gravity. Any blood that accumulates in a vein will increase the pressure within it, which can then be reflected back into the smaller veins or venules and eventually even the capillaries. This increased pressure in the capillaries will push the fluid out of the capillaries and into the interstitial fluid, causing a condition called edema. Most people experience a daily accumulation of tissue fluid, especially if they spend much of their work life on their feet. However, clinical edema goes beyond normal swelling and requires medical treatment. Edema has many potential causes, including hypertension and heart failure, severe protein deficiency, renal failure, and many others. In order to treat edema, which is a sign rather than a discrete disorder, the underlying cause must be diagnosed and alleviated. Edema may be accompanied by varicose veins, especially in the superficial veins of the legs. This disorder arises when defective valves allow blood to accumulate within the veins, causing them to distend, twist, and become visible on the surface of the skin. Varicose veins may occur in both sexes, but are more common in women and are often related to pregnancy. More than simple cosmetic blemishes, varicose veins are often painful and sometimes itchy or throbbing. Without treatment, they tend to grow worse over time. The use of support hose, as well as elevating the feet and legs whenever possible, may be helpful in alleviating this condition. Hypertension. Hypertension is defined as a chronic and persistent blood pressure measurements of 140/90 or above. Pressures between 120/80 and 140/90 are defined as pre-hypertension. Hypertension is typically a silent disorder, and patients may fail to recognize the seriousness of their condition and fail to follow their treatment plan, putting them at risk for a heart attack or stroke. Hypertension may also lead to an aneurysm, peripheral arterial disease, chronic kidney disease, or heart failure. Hemorrhage. Minor blood loss is managed by hemostasis and repair. Hemorrhage is a loss of blood that cannot be controlled by hemostatic mechanisms. Initially, the body responds to hemorrhage by initiating mechanisms aimed at increasing blood pressure and maintaining blood flow. Ultimately, however, blood volume will need to be restored either through physiological processes or through medical intervention. If blood loss is less than 20% of total blood volume, fast-acting hemostatic mechanisms causing increased cardiac output and vasoconstriction would usually return blood pressure to normal and redirecting the remaining blood to the tissues. Blood volume will then need to be restored via slower-acting hemostatic mechanisms to increase body fluids and erythrocyte production. Circulatory shock. The loss of too much blood may lead to circulatory shock, a life-threatening condition in which the circulatory system is unable to maintain blood flow to adequately supply sufficient oxygen and other nutrients to the tissues to maintain cellular metabolism. It should not be confused with emotional or psychological shock. Typically, the patient in circulatory shock will demonstrate an increased heart rate but decreased blood pressure. Urine output will fall dramatically, and the patient may appear confused or lose consciousness. Unfortunately, shock is an example of a positive feedback loop that, if uncorrected, may lead to the death of the patient. There are several recognized forms of shock. There's hypovolemic shock, caused in adults, is typically caused by hemorrhage. Cardiogenic shock results from the inability of the heart to maintain cardiac output. Most often it results from a myocardial infarction or heart attack, but it may also be caused by arrhythmias, valve disorders, and cardiomyopathies. Cardiac failure or simply insufficient flow of blood through the cardiac vessels. Vascular shock occurs when arterioles lose their normal muscular tone and dilate dramatically. It may rise from a variety of causes, and treatments almost always involve fluid replacement and medications called ionotropic or pressure agents, which restore tone to the muscle of the vessels. Anaphylactic shock is a severe allergic response that causes the widespread release of histamines, triggering vasodilation throughout the body. Obstructive shock, as the name would suggest, occurs when a significant portion of the vascular system is blocked. It is not always recognized as a distinct condition and may be grouped with cardiogenic shock, including pulmonary embolism and cardiac tamponade. Treatments, depending on the underlying cause and in addition to administering fluids intravenously, often include the administration of anticoagulants, removal